other issue that certainly arose as a result of the COVID-19 pandemic was the management of supplies, and how we might think that healthcare is local because we see our local healthcare provider, our local community hospital system. But we learned the hard way that healthcare is actually global, and that you've got to have systems in place driven by technology that sort of brings the world and its supplies to where they're needed. So as a result of the fact that we saw deficiencies in supply chain, it's going to be imperative on legal departments and healthcare attorneys to be paying more attention, I believe, to supply chain contracts and the ways that we ensure that there's not only primary resources for needed supplies, but secondary resources. I mean, previously, supply chain types of contracts were things that, only the purchasing department was giving, full review to. I think we've learned that in order to avoid some of the price gouging that we saw as a result, unfortunately, of the pandemic, that finance and legal departments are going to need to pay much more attention to supply chain. And as a result, there are technologies that can help moving forward. And so at least determining whether your contractors have the ability to fulfill those needs in a real way is going to be important, I think, for the future healthcare delivery.